We're going to talk about Kidney Cancer 101, the basics, just kind of go over a very high-level overview of what kidney cancer is. The menu, even though there's no food on this menu, is we're going to talk about what are kidneys, what is kidney cancer, are all masses, kidney masses, actually cancer or not, and how do we treat kidney cancer in very brief detail. So the kidneys are a set of paired organs. They're located in your back. They're often described as kidney bean shaped because that's where the kidney bean obviously kind of comes from, the acronym, or at least the pseudonym rather. They filter blood to eliminate waste. That's in basic what they do, and this is kind of a cartoon or an anatomical diagram of what the kidneys look like. So blood goes in, blood comes out, a certain amount of urine as waste is excreted into your bladder, and your bladder then excretes it to the outside world. So what is kidney cancer? So kidney cancer is a cancer or a tumor that develops inside the kidney, so in the meat of the kidney, specifically in where the urine is produced in a series of tubes within inside the parenchyma, or the main meat of the organ. As I describe cancer to patients, cancer is anything, at least in this case, that's inside the body that grows faster than it should. That's why it forms a tumor or a ball of cells. In the picture on the right, it has the ability to move around the body, and it's when it moves around the body that it has the potential to take your life. And I think that that's what is really important. And you can kind of see that in the picture on the right with the cells breaking through this tumor capsule trying to get to other places in the body. Kidney cancer is quite common. There are 80,000 new cases a year. It accounts for about 15% of cancer mortality. So not a lot. We do a pretty good job at obviously curing kidney cancer, and obviously there's a range, right? Some are curable, some are not. Some are something that we treat lifelong. It's the 8th most common cancer. The lifetime risk is quite small. It's about 1 to 2%, and generally affects men more than women. And like we've already stated, as Tracy stated earlier, it affects people as they age. So, the rates of kidney cancer in the United States are quite common, in certain areas more than others. This is kind of a heat map of where kidney cancer lies across the United States, and if you look in particular at Louisiana, we're obviously very affected. So, you want to be, this is a good place to start when you're learning about kidney cancer and maybe your journey. So how do I get kidney cancer? What happens? We talked about there's 80,000 new cases, but it's pretty rare overall. How do I get it? How am I at risk? And there are definitely modifiable risk factors and non-modifiable risk factors. The modifiable risk factors that we know about include smoking, obesity, high blood pressure, and consumption of alcohol. And then there are non-modifiable risk factors. So these are things that we're born with, things we can't change, such as our genetics, our family history. So if our mother, father, brother had kidney cancer. Hereditable syndromes. So these are things where there's a constellation of symptoms that we might have associated with many other disease processes that also increase our risk for kidney cancer. Gender, as we just spoke about, males more than females. Race, certain races are more affected than others. Sickle cell trait disease, and even being on dialysis. So this is just a list of the hereditary syndromes associated with kidney cancer. I'm not going to go through each one of them or the constellation of symptoms associated with these syndromes or manifestations, but I just wanted to put this up here, and if you're one of these people or have been told that you have one of these syndromes, certainly want to talk to your doctor about possible screening and things like that. So what are the symptoms of kidney cancer if I'm going to have it? Well, flank pain is one of them. Blood in the urine. This is probably the most common that we see today. We call it hematuria. It would look a little bit like this, if you were peeing bright red blood. But it doesn't always have to be bright red blood in the toilet. Sometimes it's blood that's seen on a lab test, seen under a microscope. So you might pee in the toilet, it may be yellow, but your doctor says, hey, actually there are red blood cells in there, and maybe you want to get checked out for something like kidney cancer. A palpable mass, and even fever. Now, the vast majority of kidney cancer is not found with any of these symptoms. It's found incidentally on imaging, and it doesn't present with any of the things that we talked about. It could be completely silent. You may be walking around one day and get a scan and go, man, I've got kidney cancer, I didn't even know it. As Tracy pointed out earlier, she came in for a problem of shortness of breath and found that she had kidney cancer. So it doesn't necessarily present with symptoms. And like other cancers, like prostate, colon, breast, there are no screening tests that we routinely use for kidney cancer unless you have one of those hereditable syndromes that we discussed earlier. So this is the doctor's most favorite friendly machine. This is the CT scanner, and this is how we most often diagnose kidney cancer today, because people come in for a cough, cold, nausea, vomiting, chest pain, shortness of breath, and they get a CT scan and they're found to have a mass on their kidney. This is an image on the left of what a kidney mass would look like on a CT scan. This is what your doctor might show you in clinic. I think one of the things that I always wonder is, what's the patient thinking when they see that? They're always kind of wondering, well, what does that look like in my body? And that's the picture on the right. So it's this ugly looking tumor in the kidney on the right. You can see it's ugly enough that we probably want to take that out. And that's sometimes what we do. Now, every time you get a CT scan and there's a report of a mass on a kidney, it's not always kidney cancer. The most common mass that we see on a CT scan when a mass is identified is actually a renal cyst. And this is what a cyst looks like. A lot of my patients are like, what is that? Is that going to go away? Is that going to stay around? And the answer is, we don't always know why these form. The vast majority are benign. They don't carry any malignant potential because they don't have any solid components within them. We often describe them as water balloons, and unfortunately they don't go away. They usually stick around, okay? But usually that's just okay. Now, not all cysts are the same, so while the most of them are benign or not cancer, you should get them checked out by your doctor. So here's a list of benign renal masses. There's a lot. This isn't a comprehensive list. This is just some of the most common ones that we know are benign that are found in the kidney. So not every mass on your kidney is a cancer. Not every one needs to be treated the same, and not everything needs an aggressive treatment. So how do we know if something's cancer or not? Well, there's a couple of imaging characteristics that we use on CT scan to identify something as a cancer, and one of them is whether it's solid or cystic, like we just talked about. Solid being having some solid component and cystic being fluid filled. Enhancement or hypervascularity. This is something your doctor may talk to you about when he looks at your CT scan. The image on the left is without contrast, which is given through the vein, and the one on the right is with contrast, given through the vein. And what we can see is that this tumor with the arrow in it lights up like a light bulb, and that's a definition, or that helps us define hypervascularity within a tumor, suggesting that there's a lot of cells, they want a lot of nutrients, and they want to grow. All kind of signs of cancer are bad things. The other thing is size. So increasing in size is associated with a greater risk of malignancy. So small masses, 1 to 2 centimeters, may not be cancer. They might be benign. Something that's 10 centimeters, probably more likely to be cancer, but not always the case. So what about biopsy? I mean, do we only use imaging characteristics to identify cancer? That would be kind of odd. And the answer is no. Sometimes we use biopsy. We don't always, because in most cases we don't need a biopsy to determine that something needs to come out. And some of the treatment options are very safe and provide low morbidity to patients, so we just go ahead and treat. But I do want to talk about biopsy and let patients and caregivers know that it's safe. It's about 80% accurate. It's got less than a 5% risk of complications. And there's virtually no risk of spreading the tumor as we know it with modern techniques employed today. So, biopsy is a good thing, and you should ask your doctor about it if you feel like it's necessary. This is just a cartoon of somebody in a CT scan getting a biopsy of their kidney tumor. So what about cancer staging? Everybody wants to know about cancer staging. It's important. It's what we know. It's like what we learn about cancer when we're 3 years old. Like stage 1 is good, stage 4 is very bad. This is kind of a very simple diagram of what the stages are for kidney cancer, but stage 1 is generally small and it's confined to the kidney. Okay, stage 2 is larger, still confined to the kidney. Stage 3, we're talking about bad business. It's starting to go through the kidney into the fat, maybe into some of the veins, or even into the big vein that carries blood back to our heart. Okay, and then stage 4 often describes distant spread of the cancer. So we're talking about lymph nodes, other organs, liver, lungs, bones, things like that. Okay, and each one of them is obviously treated very differently. So once I have a diagnosis of kidney cancer, it's very important that you understand what the histology is, and your doctor will talk to you about it, because really there are lots of different versions of kidney cancer, and these are just some of them up here, and there's even more than this per the World Health Organization. They have like 20 different types. But at the end of the day, clear cell renal carcinoma is the most common. Some of these are less common, and they're all treated slightly differently based on their presentation in the metastatic setting or when the cancer's moved outside of the organ itself. So it's important for you to understand this and talk to your doctor about that if that is the case for you. Okay, so I've got kidney cancer. What do I do now? I think the most important thing is obviously to find a urologist. They're the ones that treat kidney cancer and can help you find a medical oncologist, a radiation oncologist, somebody to do a biopsy or whatever it may be. And you really got to find somebody you feel comfortable calling on in times of need. At the end of the day, things don't always go well with cancer, whether that's surgery or medicine. There's side effects, there's complications. And you want somebody who's going to sit there and dig in with you when times are tough, because at the end of the day, it's not always rainbows and butterflies like the Keytruda commercials that we see. You want to talk about the management options. There are many, and we're going to hear some other speakers today talk about active surveillance, which is just watching the mass. Sometimes these masses grow very slow and don't need treatment. Ablation, burning or freezing of the mass. Surgery, taking out just part of the kidney, which is the tumor, or taking out the whole kidney. And even radiation, which is kind of new on the horizon. It was done many years ago and kind of back in favor. And then finally, stage 4 cancer, you're going to need systemic therapy, so we want to treat the whole body. You're going to need infusions and oral medications to treat the whole body, because it's not just the kidney that we're trying to focus on. And that's important to be done in a multidisciplinary fashion between all of the doctors that you can hear from today. Surgeons, oncologists, radiation doctors, etc. And lastly, shared decision making. So there's no one size fits all, okay? I think all the patients in here have the same story in that they had a diagnosis of kidney cancer, but the journey along that time point to where they are now is very different. And so I think it's important that you find somebody who can talk to you about all the options available. And if your tumor is complex, you should find a surgeon with experience treating complex kidney tumors. I don't think it's wrong for patients to ask, how many of these surgeries you've done, how long you've been in practice. I think it can be obviously off-putting to many doctors, but listen, it's your life that you're putting in their hands. It's important for you to know what you're getting yourself into. So in conclusion, kidney cancer is a tumor that starts in the kidney and has the ability to move around the body. That's what defines a tumor versus cancer. It's when it moves around the body that has the potential to take your life. There are no screening tests that are routinely performed unless you have a hereditable syndrome. And kidney cancer is most commonly found incidentally, so it's not found with the signs and symptoms that we talked about. Most kidney cancers these days are curable. I think that's important. Though when they spread outside of the kidney, they can be more challenging to treat, still manageable, but more challenging to treat, and sometimes involve a multidisciplinary approach involving radiation oncologists, medical oncologists, and surgeons. So I hope that helps set the stage for the rest of our talks today.